Welcome back to AM Northwest. In today's HealthCARES with Dr. Chong, we're talking about relationships, specifically the relationship between a doctor and a patient. Here to share some very important information, we welcome from Radiation Oncology Care at Meridian Park, Dr. Lance Chong and his special guest, Dr. Natalie Johnson, a surgical oncologist with Legacy Medical Group. Good to have you both with us.
Thank you.
I was saying to you before we went on, I know you both now personally, and you both have the bedside manner of a doctor that cares, which is very important. So let's talk about that specifically, Dr. Chong. So let's talk about the different approaches that doctors have.
Well, doctors have different clinical styles, different personalities, and I think that the patients need to really define what type of a doctor they want,
Right.
so that they can do their research much more than where they went to medical school, where they did their training, but also what is their clinical style, their bedside manner. Because I truly believe that this can really help that patient get to that healthy position they want or their home medical care. It's a relationship.
Dr. Johnson, do you think it's, if patients know that you care about them, they're more willing to follow through on what you tell them they need to do?
I
Is that
think
part of it?
that's true. Also, from caring for people, understanding where they are and what they bring in their disease or this place that they're in also helps you to do a better job of caring for them, is understanding what issues they have and emotions that they have and understanding that they have helps you to really care. And I was telling Dr. Chong that for me, to love and care for a patient, you receive that back. So if you feel that your doctor really cares about what happens to you, even when things are hard, you feel like you're there with them. It's
Right.
a team.
Right.
And it just is a better feeling and a better way to be healed.
Well, how does a patient find out what your personality style is or your bedside manner? How do we find that out?
There are several different ways. Word of mouth, I think that's very, very prevalent in terms of patients talking to relatives, friends.
Yeah, very true.
That so many of us actually end up in the doctor's office, and that's when you can actually see that interaction. I also say that what is their staff like? Because I think the staff and how they treat you from the very first time you walk in there is a reflection of that physician and their style. And I think it's important that once you get in and get a feel, are you just a number, or is this
Right.
a place where you feel you can develop a medical relationship that's positive and you want to be there, and that physician wants you to get better and you feel that caring.
Right. You both treat breast cancer patients.
Yes.
And Dr. Johnson, I know that you also were diagnosed with breast cancer a while back. Did that change things, or did it help you in your practice?
I always felt I was a very empathetic caregiver.
I would agree with that.
But in going through cancer myself has really helped me to deepen that, and also to really understand the feelings and emotions of going through a cancer diagnosis, your hopes, your fears, and to relate to people more in that way. I can also describe from personal experience what some of the side effects,
Right,
you
because
know,
you've been there.
Yes.
Right. Now, you two work on some of the same patients. Do you connect? You both have the same approach, it sounds like. Do you connect together and talk about each patient so that you both have the same style going in?
Yes, we do. It's important to discuss these cases clinically so that you're on the same page. And I know that it's very important for Dr. Johnson and who she gets to care for her patients, that they are similarly cared for and not just treated. That's what they tell me.
Right.
Yes.
It's about the whole patient.
Yes.
Yes.
Not just about this one.
Yes.
Okay, we want to take a break and we want to come back and we want to talk about patient responsibility when we return. So we'll be right back with more. Don't go away. We're We're back now with Dr. Lance Chong from Radiation Oncology Care at Meridian Park and Dr. Natalie Johnson with Legacy Medical Group. We've been talking about doctor-patient relationship. What should we as patients be doing to make sure that the relationship works? So Dr. Chong, let me start with you. What is some advice that you have for the patients when they go to see their doctor?
I think that there are certain technical things that need to be dealt with. A history, they need to jot down certain points in a chronological order, the history of their symptoms, their problems. They need to then have questions that they may like answered so that when they get in there, they have points to try and cover.
Yeah, because oftentimes we have lots of questions before we get in the doctor's office. Once we get to the doctor's office, we forget those questions.
Yeah.
Absolutely.
Right? So be organized is your number one tip.
Yes.
Be organized and have your notes ready.
And while people are going on the internet, be very, very careful about
that can
its
take you
use.
down
Yes.
a rabbit hole.
Yeah.
And a very scary one.
Scary.
Yeah.
It's very scary when you do
Yes.
that. Would you also, Dr. Johnson, suggest that when folks come in, for instance, especially when we're dealing with cancer, bring in someone who can be objective and take notes?
I think that's an excellent idea. I always worry about people who come in alone.
Right.
Because it's a lot of information, your emotions play into what you hear or don't hear. We try to give good notes, but it's always good if you have an objective person who can really sit and take notes, even if it's a spouse or partner. Sometimes their emotions are going as well and they don't hear all the information.
I took my mother, that was the wrong thing to do. Yeah, because her emotions were running high too, and you really need someone who's going to listen and be objective about things,
Yes.
right?
And also ask some questions that maybe
I wouldn't have thought of.
Yes.
That the patient wouldn't have thought of. A good relationship is key to anything when it comes to having relationship with your doctor, right? And you talk about healing the whole patient, not just the disease.
Right. I think that's crucial. Find a doctor who is a true physician and not looking at it as a job.
Right.
The importance of having someone who comes from a place of I'm caring about how you feel, I want to help you get better is crucial. It's not just a matter of collecting facts and giving you facts. There's much more to true physicianship than that. There's this compassionate aspect where you're listening to a patient because you care. You're trying to understand them so that you're not taking the authoritarian position of I'm the doctor and you listen to me and that's it. I think that things are very, very different, caring and not just treating. There are many physicians, but there are few healers.
Right. And it's also important too, I would think, that patients come in with a positive attitude.
I do think it is, but sometimes people come in with baggage. You know, I met someone yesterday actually who came in, was very short and rude and snippy, and and our staff just said, we don't understand why she's that way, but there may be something. So once she got in and we started talking, her mother died of ovarian cancer, and her sister just recently died of cancer as well. So even though she has a breast cancer with a really good prognosis, she's coming with extreme fear.
That's why you need to know the whole situation.
Exactly. So just to hear that and to hug her and say, I know you have to be really scared, but we really honestly feel you're going to do well. So let's get you through this. Let's talk about how we're going to take care of you. And just understanding her background gave a different light on her behavior. And then the whole office hugged her, our staff, everything. She's like, I'm sorry. And I said, forget it. We understand, and people behave in different ways or react in different ways when they have those emotions of fear or uncertainty.
Absolutely. Thank you both very much. You want to find out more about HealthCARES with Dr. Chong, the information's on our webpage at k2.com.